Hello, myself Mohammad Riza Ahmed, and I belongs to group number 466. I am a fourth year medical student of Astana Medical University. So today my topic is about that conversations of the patients with the family plannings counseling about the oral contraceptive method. First of all, we should have to introductions ourselves as a doctor to the patients, to have a comfort zone to talk with the patients about this type of issue. So firstly, if the patients will come about this issue to us, then we should have to light conversations with the patients. And secondly, we will take some history from the patients. The history included is that there should be some, we'll check for the vital signs, we'll check the previous history about the pregnancy, how many times she pregnant, or about the other pregnancy related issues. So we'll check for the other chronic diseases like hypertension, diabetes, this type of diseases, and we'll check temperature and other vital signs. So secondly, if the patients do not want to have a future pregnancy, so we'll educate the patients. It is the most important thing to educate the patients about the oral contraception. So as you know that barrier method is like condoms and the oral contraceptive pills. If the patient chooses to take oral contraception pills, then we should have to educate about the side effect. We should have to educate the taking of the oral pills on which method. If she wants oral contraceptives that are basically prevents the pregnancy because they are combinations of the progesterone and the estrogen hormones. These progesterone and estrogen hormones, they will changes the lining of the mucus and of the cervix and the vagina. So the mechanism of action is that they act inside of the body of the woman and don't let the mating of the sperm, and if there is the end does not provide the suitable environment for any placenta. But basically Cooperative method is have a very useful method in the intrauterine devices because it has less side effect. Thirdly, we will discuss if the patients have some religious or caste issues, then we will discuss about that. And if she want the only oral contraceptive drugs, then we should have to provide the oral contraceptive pills according to according to the vital signs, the body signs, and some after looking for the other previous history, and then we will prescribe this oral contraceptive method. Fourthly, we will educate the patients about the oral contraceptive pills. So we'll educate the patients that oral contraceptive pills have so many side effects, like some patients will get nausea, vomiting, some patients will increase in temperatures, some patients have other vital signs, also have the hormonal swings. Then in this case we'll advise her to take the oral contraceptive which have less side effects, which is available in the market. But one thing we should have to aware about that if the patients have the hypertensions, then we should have to aware about the oral contraceptive method, because some oral contraceptive pills will increase the BP, blood pressures. On the basis of her choice, we will prescribe the monthly pills or the weekly pills. The monthly pills is that the package of the 21 pills, and these pills the woman should take from the first to fifth days of her menstruation cycle. And one of the most important things to inform the patients is that oral contraceptive pills do not protect from the STD infections. So it can be protected by the barrier contraceptive method like condom. Conclusion is that after taking all of the history, after looking for the vital signs, after taking the after looking for the all of the disease of the patients, chronic diseases, so will comes in conclusions that we should have to prescribe on the basis of these signs, symptoms, history. Will prescribe the oral contraceptive pills.